Cervical cancer is the fourth most common cancer among women globally. So let's learn more about it. Cervical cancer happens in the cells of the cervix. The cervix is the lower part of the uterus that opens into or connects to the vagina. The primary cause of cervical cancer is persistent infection with certain types of the HPV or the human papilloma virus. Other risk factors include multiple sexual partners, early initiation of sexual activity, multiple full-term pregnancies, smoking, as well as a weakened immune system. How do these risk factors lead to cervical cancer? Let's take smoking, for example. Smoking actually decreases the body's ability or the immune response to fight against the HPV viruses. Individuals with a compromised immune system are less likely to effectively fight against HPV virus or multiple reinfections of the HPV virus. So this leads to proliferation of abnormal cells in the cervix. Prolonged use of hormonal contraceptives are thought to possibly alter the epithelial lining of the cervix, making it more susceptible to HPV infections and progression to cervical cancer. Hormonal changes during pregnancy, as well as a slight suppression of the immune system so that the mother's body does not reject the fetus, can also lead to cellular changes in the cervix, as well as frequent trauma of the cervix, which may happen during delivery, can also predispose a woman to cervical cancer. Early sexual activity and multiple sexual partners simply increases your likelihood of contracting HPV. I want to get to the nursing management of persons diagnosed with cervical cancer. But before we do that, let's dive into the pathophysiology, the clinical manifestations, and treatment, and then talk about nursing management. So stick around. Let's talk pathophysiology. So the HPV infects the basal epithelial cells of the cervix. They then integrate their DNA into the host cell genome. When this happens, they now have the opportunity to suppress tumor suppressor proteins that our bodies naturally have. When these are suppressed, the HPV virus or the HP virus, human papilloma virus, now has the opportunity to just proliferate without anything stopping it from proliferating. Now, this can lead to cervical intraepithelial neoplasia. And if a person with SIN, it's called SIN, goes to their doctor at this point and they do a pap smear, then this can be found and some intervention can happen. However, if this goes undetected because you didn't go for that pap smear that you are due, then the HPV can now go deeper into the cells of the cervix. And this, over several years, is what leads to cervical cancer. Early stages of cervical cancer are often asymptomatic, which is why you really need to go get that pap smear. As the disease progresses, symptoms may appear. These symptoms include unusual vaginal bleeding, post-coital, intermenstrual, and premenopausal. You may also experience pelvic pain, pain during intercourse, and changes to vaginal discharge. Treatment of cervical cancer depends on the stage of the cancer. Early stages are usually treated with surgical intervention. Locally advanced stages are usually treated with chemoradiation, and the most advanced stages are usually treated with palliative care, maybe some chemotherapy, some immunotherapy, some targeted therapy. Let's review the nursing management of persons diagnosed with cervical cancer, utilizing the nursing process. For assessment, you have to assess the patient's vital signs, assess any signs of metastasis, do an overall assessment, including assessment of the cervix. You must do an evaluation of their symptoms. Are they experiencing vaginal bleeding, abnormal vaginal bleeding, pelvic pain? If they have a discharge, what does the discharge look like or smell like? What are the characteristics of the discharge? Don't forget to do a psychosocial evaluation. Is the patient coping well? Are they anxious? Do they have support? What does that support look like? Don't forget to look at the laboratory studies and the findings. What were the last pap smears like? What are the blood studies like? What are the HPV tests like? So that's also very, very important. Diagnosis. We can anticipate certain diagnoses based on how the condition typically presents for most patients. But bear in mind that you can have 2, 3, 4 patients with the same diagnosis, and their diagnoses in terms of nursing diagnostic statements will differ or may differ. Some nursing diagnoses to anticipate are excessive anxiety, formerly anxiety, inadequate health knowledge, formerly deficient knowledge, or readiness for enhanced health knowledge if the patient does possess some knowledge. Risk for infection may also be used, but be careful since cervical cancer in itself is a type of infection or as a result of the HPV infection. But you can say risk for infection related to immunosuppression caused by chemotherapy. You may also diagnose this patient with inadequate nutrition intake because usually the nausea prevents the patient from having adequate nutritional intake. Risk for inadequate nutritional intake may also be applicable to your patient. The other aspects of the nursing process include formulating goals, which will be patient dependent. It could be as simple as patient will verbalize a reduction in pain, and you have that being measured by patient rating the pain a little less. Of course, there are nuances in terms of how our goals are phrased, and I do help students with things like that in our nursing care plan courses. The implementation also should be based on whatever goal you had formulated for each of the problems identified, and then you evaluate to see if the interventions were effective at attaining the goal that you aimed for. If you want to learn more about this topic, feel free to let me know in the comments. If this video has helped, also let me know that. Bye-bye.